Good afternoon, good evening. My name is Farima Daftari, and I'll be facilitating today's webinar. Welcome. As with our previous webinars, the intention today is to promote interparliamentary dialogue, particularly among members of the OSCE Parliamentary Assembly on the most pressing issues on the global agenda. We're pleased that we have such high interest from members of Parliament, and we're especially pleased that we're joined today by three high-level expert speakers. Gabriela Cuevas, co-chair of the UHC 2030 International Health Partnership, welcome. Francesca Colombo, head of the OECD Health Division, and Kyle Knight, senior researcher on health and human rights at Human Rights Watch. Thank you very much for your readiness to contribute your insights to this online policy debate. Our discussion today is a continuation of a series of parliamentary web dialogues we began following the onset of the pandemic on issues of particular focus and priority for the OSCE Parliamentary Assembly. The discussion today is also particularly relevant in advance of the upcoming OSCPA annual session. Today, we turn our attention to focus on health as a human right. The relevance of health-related issues has become abundantly clear in the past year and a half. So I'm pleased that we have this opportunity today. Just a few technical aspects. I will let our guest speakers introduce today's discussion, but please allow me to address a few technicalities. Please note this webinar is being recorded and broadcast live on our YouTube and Facebook pages. If you have any connection problems, please contact our team in the chat, and they'll do their best to help you. We have 3-language interpretation into English, French, and Russian today. And I'm sure you're familiar with the procedure, but if you need to switch language or interpretation, you can click on the little globe at the bottom of the Zoom screen. If you wish to take the floor in the discussion, please indicate so on the webinar chat and write to everybody so that our colleagues can compile a list of speakers. And I would encourage you to be clear and succinct in your remarks so that everybody has a chance to speak and we have a good discussion. Well, we have limited time today for a big topic, so without any further delay, let's proceed. Before we continue, I would like to ask our Secretary General, Mr. Roberto Montella, who is here to say a few short words to introduce today's webinar. Thank you.
Thank you, Farima, and welcome to all our friends and guests. Hello, Gabriela, Francesca, and Kyle. Thank you very much for approaching us, Gabriela, with this idea. I remember you as a very strong leader of the IPU and learned a lot from how political leadership should be given into international organizations. As you know, we have often discussed how it is important that in parliamentary assemblies, the leadership is vested with the political leadership. And here, this international secretariat is at the service of the political leadership of our assembly. So I very much welcome you approaching us with this important initiative. The outbreak of COVID-19 pandemic has showed us how crucial the access to free care is and how healthcare must be indeed considered a human rights. And I'm sure we'll discuss this at length today. It's important to have this discussion, this conversation with parliamentarians. And I understand there are also members of the IPU as well as our OSCE Parliamentary Assembly members. It's important to have this discussion with parliamentarians because parliamentarians are the ones who have let's say, power of the purse. They are the ones who decide where resources need to be allocated. And so it's important that they are convinced of how important it is to have plans based on inclusion and on equal opportunities. And I hope that this can be also one of the first events that we have within our Parliamentary Assembly to also be engaged on this issue. And here I'd like to thank Carrie Henriksen for the leadership of this issue within our Assembly and also for pushing very much on this front in our Assembly. Gabriela, in the Universal Health Care Coverage leaflet that you have distributed, you, in one of the points, you talk about international cooperation based on mutual learning across countries, regardless of the development status. This is one of the key principles of this initiative. I couldn't agree more. I think if one thing we've learned during this pandemic here is that international cooperation is not only something nice to do, but it's actually the most convenient thing to do. So I think international cooperation is actually absolutely a must. And therefore, it's very important that our international organizations who deal with these issues try to put together the resources they have, the intellectual, the financial resources that they have to find common solutions. And so with those words, I thank you very much, and I wish to us all a very good parliamentary dialogue on this issue. Thank you.
Thank you very much, Secretary General. We have the chair of the OSCE's Human Rights Committee with us here today, Mr. Kyriakos Hagiani from Cyprus. He will say a few words of introduction to the topic. We will then hear from our three expert speakers. And after that, we will have good time for discussion. And before closing, we will also hear from the rapporteur of our Human Rights Committee, Vice President Carrie Henriksen. So Mr. Hagiani, you have the floor. Thank you.
Good afternoon from Cyprus. Dear colleagues, distinguished guests, I'm pleased to welcome you today to this critical discussion of health as a human right. Never before has there been such a focus on this aspect of our common security. With 169 million confirmed cases and 3.5 million deaths so far, the COVID-19 pandemic has put persistent complications surrounding the implementation of the right to health into stark relief. But as we proceed with the vaccination of our constituents and begin to recover from this global crisis, it is imperative that we not forget our enduring duty to facilitate the delivery of quality and inclusive medical care. More than half a century ago, in the Universal Declaration of Human Rights, we committed to a standard of living adequate for the health and well-being for all. It is a promise we have repeated on many occasions since then, also within the OSCE. As a result, participating states have pursued a number of different strategies. While some have established national public systems, others have prioritized the promotion of a more private approach. Yet, despite valuable progress, the realization of the right to health continues to elude us. According to certain estimates, half of the world's population still lacks access to the medical services they require. And year after year, related expenses drive around 100 million people into extreme poverty. As such, it is easy to see the linkages between the right to health and other basic guarantees. For many individuals, their health may be the only asset upon which they can rely for their survival. Once they are deprived of their health, they might be expelled from their education, lose their work, or not be able to afford their housing. The exclusion of marginalized and particularly vulnerable segments of society is thus all the more worrying. Underlying socioeconomic inequalities have been proven to lead to a higher risk of minorities contracting and succumbing to illness. Similarly, migrants and refugees have often been ignored or neglected by authorities. Dear participants, COVID-19 has demonstrated not only the fragility, but also the interdependence of our collective health. Therefore, I believe that the time has come for us to recognize that until all of us have access to the medical care we need, none of us is truly safe. In this context, I want to extend our gratitude to the expert speakers joining us today. The UHC 2013, the OECD Health Division, and Human Rights Watch all do indispensable work in their respective fields to provide policymakers like us with key information and input on how to address demands for better medical care. And thank you, dear colleagues, for taking part in this event. I very much look forward to our exchange. With this being said, I now ask Farima Daftari in the Secretariat to please help facilitate the rest of our discussion today.
Thank you, Mr. Hajiani. I'm now pleased to introduce our three high-level speakers whose contributions I'm sure will be invaluable. I will first give the floor to Gabriela Cuevas-Baron, co-chair of UHC 2030. As you have heard, UHC 2030 is an international partnership aimed at achieving sustainable progress towards universal health coverage. All participants who register for this webinar should have received a copy of the Global Compact, so you have a general idea of the intentions. This partnership is supported by a range of countries and numerous UN and affiliated organizations. Ms. Cuevas is well known to us in the OSCE, having already contributed to one of our webinars last year. First elected at the age of 21, she has been a federal member of parliament in Mexico 3 times, as well as a local member of parliament and a constituent member of parliament in the Constituent Assembly of Mexico City. In 2017, she became the youngest and the second woman president of the Inter-Parliamentary Union. Ms. Cuevas-Baron is currently co-chair of the UHC 2030 Steering Committee and co-chair of the Lancet COVID-19 Commission's Task Force on Humanitarian Relief, Social Protection, and Vulnerable Groups. Ms. Cuevas-Baron, thank you for joining us. You have the floor.
Thank you. Thank you very much for the invitation. Thank you, Roberto, for this constant dialogue that we have had, first with the Inter-Parliamentary Union, now with UHC 2030. Thank you very much for this possibility to exchange our point of views, our perspectives and policies and legislation and all what we can do as parliamentarians for giving access to health to all people. I wish to thank the Parliamentary Assembly of the Organization for Security and Cooperation in Europe for organizing this timely event on health as a human right, as well as the participating delegations that have joined us today for what I hope will be a thoughtful and lively discussion. I am glad to be here, and I appreciate the opportunity to share some thoughts on the role of International Health Partnership, UHC 2030. Medical science has made impressive progress over the last decades, making healthier and longer lives a greater possibility for human beings. Having said that, I would like to emphasize that making that progress accessible so that everyone, everywhere is able to exercise the human right to health remains mainly a matter of political will. Ultimately, this is a decision that must be made with leadership. The pandemic has evidenced shortcomings and neglect of healthcare systems, which must not be, under circumstances, be allowed to happen again in the future. This is our work in UHC 2030. UHC 2030 is a multi-stake platform that seeks to accelerate progress towards universal health coverage, building on historic commitments that were secured at the United Nations high-level meeting on UHC in 2019. Achieving UHC means living in a world where everyone can access quality health services without facing financial hardship. But there are considerable challenges to overcome to make this happen. At least half of the world's population lacks access to essential health services. Even more, financial burdens get in the way of people having healthy lives. In 2015, around 930 million people had to spend more than 10% of their household income on healthcare. About 210 million spent more than 25%. The percentage of the population that has been impoverished due to out-of-pocket health expenditures has increased from 1.8% in 2000 to 2.5% in 2015. While there has been progress, more must be done. According to WHO projections made in 2019, in the best case scenario, only 63% of the global population will be covered by essential health services. Even in that case, again, the best case scenario, 37% will still be deprived of the human right to health. If we work on spending our primary healthcare interventions in low and middle income countries, by 2030, 60 million lives could be saved and the life expectancy will rise by 3.7 years. Investments in health systems can save up to 100 million lives as well. Allocation of at least an additional 1% of GDP in primary healthcare could make a big difference. In this context, what can we do as parliamentarians to bolster the agenda for UHC? As a parliamentarian, I have been a parliamentarian almost all my life, I am convinced that we can bring positive and significant change to each and every one of our countries. And this is especially true for universal health coverage. Legislation, allocation of national budgets, representation of our constituencies, and oversight of government action are all within our purview and responsibilities. And all of them play a key role in the implementation of UHC commitments. UHC legislation is crucial. In the latest State of Commitment to Universal Health Coverage, which outlines the progress made so far, our findings show that only a handful of countries have set explicit UHC targets to increase coverage of essential health services described on SDG indicator 3.8.1 or financial protection, which is at SDG the 3.8.2. Commitments must be reflected in our laws and regulations and establish binding responsibilities for relevant governmental agencies. Otherwise, there is nothing that guarantees the transformation of these international commitments into realities that benefit the day-to-day lives of the people. UHC 2030 also calls for increased investments in public health and primary healthcare, prioritizing both UHC and pandemic preparedness. Generally, this is a decision that cannot be made without the cooperation and involvement of parliaments. The pandemic has proven the direct consequences of inadequate resource allocation to public health services and preparedness, supply of medicines, equipment for medical personnel, and sustained health policies such as other vaccination campaigns that COVID-19 are all examples of areas which are considerably undermined during the earlier months of the pandemic and a great cost in terms of human lives. Commitments to UHC should be reflected in budgets and prioritize investments to that end. The cost of doing so pale in comparison to the cost that most countries have had to endure through as lockdowns forced millions into their homes, hampering economic activity across several sectors and putting the livelihoods of many at risk. As parliamentarians, it is our duty to ensure that our budgets are well designed to address the health needs of our constituents. This is also linked to our next role, representation. We have a mandate to be the voice of our constituents in parliamentary sessions, advocating for their demands and making sure that their needs do not go unaddressed. We must not only listen, but also provide opportunity for meaningful engagement and participation of the people who will see the effects of our decisions in their daily lives. This begins by building genuine partnerships with civil society and going beyond merely consulting them to comply with a checklist. Community stakeholders can be valuable partners, particularly when it comes to leaving no one behind in our policy responses. Moreover, parliamentary oversight keeps government accountable for their action, especially when commitments are not kept. As such, close monitoring of relevant indicators, including SDG indicators as I just mentioned, 3.8.1 and 3.8.2 on coverage of essential health services and financial protections are a good place to begin. Overall parliamentary action for universal health coverage is a necessary course of action because attaining these commitments means bringing well-being to our constituents. Money should not be a condition that determines whether someone receives help, which is in many cases can be a matter of political will. And if we go further, sometimes we can think that allocating enough budget would be the difference between life or death. As a human right, access to health should be available to everyone, no matter who they are or what their own financial condition may be. In a few words, truly universal, as all human rights should be. Fellow parliamentary colleagues, let us then be the ones who make health for all a reality for our people. Thank you very much for this kind invitation. It is great to be again with the parliamentary community of the OSCE Parliamentary Assembly.
Thank you very much, Ms. Cuevas, and for putting really some concrete numbers and figures to support your arguments. I'm now pleased to give the floor to our second expert speaker, Francesca Colombo, who's head of the OECD's Health Division. The Organization for Economic Cooperation and Development has long played a role in helping countries achieve high-performing health systems by measuring health outcomes and by analyzing policies that improve access, efficiency, and quality of healthcare. Ms. Colombo is ideally suited to contribute to our conversation today, bringing more than 20 years of experience leading international activities on health and health systems. She is an international expert on health and care issues for elderly populations and has led projects on quality of healthcare policies, health financing, and the impact of private health insurance on health systems, the health workforce, and the international migration of doctors and nurses. Ms. Colombo, you have the floor.
Thank you very much for this opportunity to address this distinguished audience. I will make some remarks which go very much in the directions of looking at the effects of the pandemic and how this highlights the important confluence between a human rights agenda and an economic agenda. OECD, which is an international organization that brings together 38 member countries, is actually an economic organization. But it's quite surprising, perhaps to some of you, but definitely not to me, how there is a convergence in when we look at what should be the policy options and what should be the actions that should be done to ensure that there is access to care for all. And I think all those have been very much put into the spotlight by the crisis that we are witnessing, and which is far from being over. Now, the COVID-19 pandemic has been really a shock. There is no surprise to that. There's been a shock for all countries in the world, but also for the most advanced economies that really were caught by surprise. And I think there is an important need to learn really the lessons from the crisis so that we are much better prepared, able to respond, but also to prevent future crises. And quite clearly, this is very much high on the political attention, the political agenda across all the countries. There are a number also of high-level reviews which have been launched. Some have been completed, looking really at learning the lessons for the future. And a lot of those reviews emphasize some important elements. The importance, for example, of improving the international health architecture, the importance of improving international cooperation. I will be saying a few things about that. But there is also quite a lot of emphasis on the importance of early detections and making sure that we are ready to address and identify emerging diseases. Now, for me, a very important first point to make. Sorry?
Ms. Colombo, I'm very sorry, but there seems to be an issue with your connection. I don't mean to interrupt you, but do you have some headsets handy that you could try? We're having trouble. And our interpreters are also having trouble due to the technical quality of the connection. Thank you very much.
Can you confirm if you can hear me?
I believe it's the same issue. If you can continue speaking, it's the connection.
Then why don't you go to the third speakers? I'll try to switch off completely and reconnect.
Very well, thank you, and apologies for the connection. I will, yes. Very well. I will move to the third speaker, Kyle Knight, Senior Researcher on Health and Human Rights at Human Rights Watch. I'm sure we're all familiar with the work of Human Rights Watch, as an organization known for investigations and advocacy on a wide range of human rights topics. Their human rights work examines the right to health and a healthy environment and the necessary associated rights to achieving health. As a journalist, Mr. Knight has worked for Agence France-Presse and for the UN's Humanitarian News Service in a number of countries. He has also previously worked for UNAIDS and in the Children's Rights and LGBT Rights divisions at Human Rights Watch. Mr. Knight, we look forward to hearing your perspectives on this topic. I hope you're prepared to intervene now. Thank you.
Hi, everyone. Thank you so much for having me and for having Human Rights Watch be part of this important discussion. And please do interrupt me if my connection becomes unstable. For a minute, I did think it was me that was having trouble hearing people, but I think I'm relieved that it's a more generalized issue, and I hope everyone can reconnect quickly. So when we talk about the right to health, we know it is enshrined in the International Covenant on Economic, Social, and Cultural Rights. And we know the treaty specifically refers to the prevention, treatment, and control of epidemic diseases. We also see the right to health appear in the Constitution of the World Health Organization. Indeed, it's right there in the third sentence of the document, so it's quite a high priority. And in the past 15 months, as others have said, we have seen just how critical upholding the right to health is in a particularly acute way. One thing the right to health does is it invites us to think broadly. Yes, it includes protections for accessible, affordable, and high-quality healthcare, but the right to health is not just about people being able to see a doctor. It also encompasses other factors as well. And each of these factors involves a deep consideration for the context where people live and the policies that determine their health. One thing we have heard throughout this pandemic is how COVID-19 has exposed or laid bare the plight of marginalized communities, or how the pandemic has opened eyes to how economic disenfranchisement and poverty put people at extreme risk. But while the people and the organizations making these observations may be adding some political energy to the issue, it's critical that we remember that for people living in poverty or people who experience discrimination on a daily basis, this type of suffering is not new. It's just magnified and exacerbated by the global crisis that is COVID-19. Right now, much global political attention is focused on equitable access to COVID-19 vaccines. As we all know, science has given us a way out of this crisis in the form of an injection. But getting those injections manufactured, distributed, and administered has proven to be an entirely different political problem, fraught by diplomatic level trade negotiations and community level distrust of institutions. But when we frame health just as the deployment of a vial of vaccine or as medical care alone, it can be a struggle to distinguish acute crises from prolonged economic precariousness. Tuberculosis, for example, is still claiming millions of lives, even though treatment has long existed. Framing the exit from this pandemic as a commitment to the right to health, on the other hand, invites us to think about the social, commercial, and political determinants of health. Yes, it's about treatment, but it's also about prevention. It's about food and housing and social protection and protections against discrimination throughout society. These days, while vaccines trickle out to the world, we are operating amidst a renewed wave of emphasis from public health experts that contact tracing and social protection is going to be needed now and for quite some time to come to continue to fight COVID-19. COVID-19 testing needs to continue and needs the full wraparound social protection response in order to be meaningful. In other words, if people can't afford to self-isolate because their governments aren't supporting them, we aren't really upholding their right to health or the right to health of the communities that they live in. And to add to this, an acute observation Professor Christina Pagel at University College London wrote a few weeks ago, we are entering an era where there is a very real danger that COVID-19 will become entrenched as a disease of poverty. What we've learned from past public health emergencies should be instructive for how we continue to respond to this one. In his new book about the 2015 West Africa Ebola crisis, Dr. Paul Farmer, founder of Partners in Health, invites us to ask, are our public policies vis-a-vis health meant to control people or meant to care for them? We should be asking these same questions now. Yes, we need COVID-19 vaccines. We need them everywhere and accessible to everyone. But also we need, as part of upholding the right to health, commitments to infrastructure that protects people's dignity, not just infrastructure that treats them like a potential health threat. As we think about what the COVID-19 pandemic means for the right to health and health security, we need to be attentive to the underlying questions of security for whom, security from what. Focusing narrowly on individual states simply will not work. We need cooperation. Focusing narrowly on the population as a whole simply will not work. We need to address underlying vulnerabilities that have been created by historical marginalization. Recentering the discussion on equity and the right to the highest attainable standard of health for everyone is a good starting point. And this framing invites us to see the pandemic as a wake-up call for other sectors: housing, water and sanitation, food security, social protection, and so on, all of which determine health outcomes and all of which come with human rights obligations. Thank you so much, and I look forward to the discussion today.
Thank you very much, Mr. Knight. Let us go back now to Francesca Colombo and see if the connection is better. Ms. Colombo, would you like to?
Can you hear me now?
Yes, it's beautiful. Perfect.
Yeah, so I just had to reconnect entirely, but do alert me if you don't hear me. So going back, I will focus really on some of the lessons learned from the COVID-19 crisis and how really this has caught countries, even among the most advanced economies, very much by surprise. And what the crisis really shows us is that there is a confluence and a convergence in arguments about the need to build strong, resilient, accessible to all, high quality healthcare services and health systems. And the confluence of arguments is both a human rights as well as an economic argument as well. The OECD, which is an organization that brings together 38 member states, is in the main an economic organization. So that's the lens and the focus they would normally use in our analysis. But it will probably come to no surprise to you how there is really a convergence in the issues when we look at the learning from the pandemic. Now, the pandemic, it's fair to say, has really represented and shaped us very, very much. And there are a number of high-level reviews which are actually being launched. Some of them have been completed in order to learn the lessons for the future. They all emphasize some important issues. One, in the importance of improving the international health architecture. Secondly, in the importance of including international cooperation, and I'll say a few things more about that. There is a lot of emphasis also on the importance of doing things early enough. So the early preventions, the ability really to anticipate when there's a threat that might happen. But I think if we just focus the attentions on early prevention and alert systems, this is only half of the story, because quite importantly, there is a convergence also in consensus about the need to making sure that populations, once they're hit by a crisis, can have access to health services. And so no amount really of investment that could be done into detecting an early threats will really stop any pandemic from happening, and becomes really fundamental to learn from the futures is that the fact that we need really to strengthen disease preventions and early warning system together with strong health system, resilient health system that can protect and uphold care for all. There is a consensus which is growing, and there is probably also a window of opportunity in the fact that countries do need to invest more to make those health systems more resilient for the future, that we cannot just continue business as usual, but the pandemic has shown some important weaknesses that must really be addressed. As an economic organization, we look at what would be the amount of some of those investments that we need to be put in place to build more resilient health system for populations. And we have calculated an additional investments in the order of up to 1.5% of GDP in core investments. These are additional money that we need to be directed to health systems to make them stronger enough. And I would like to say a few words about what are some elements of these core investments. The first one, it's obviously the need to accelerate progress to achieve and sustain universal health coverage. But beyond the access to care aspects, an element which I would like to highlight is the need for high quality services, because universal health coverage without quality is actually an empty promises. And when we look at the extraordinary amounts of harm that sometimes happen within health system and which is preventable, that is causes a lot of damage to individuals themselves, but to their lives, beyond obviously costing a lot of money to health system. And it's quite clear that a renewed focus on making sure that there is effective care for all, it's something that we need to put in place without any further ado following the pandemic. The second issue has to do with looking beyond the health sector, actually. The pandemic has shown the need to invest in preventing ill health and also building more resilience in populations themselves. And doing that cannot be done without tackling the health risk factors and things like unhealthy behavior, for example, but also the wider determinants of health that situate themselves outside of the health system. So renewed effort on addressing vulnerability factors such as poverty and inequality become really fundamental, and they do require working across sectors. Now, this is something in which there is still a lot of work to be done, looking at prevention of things like obesity or harmful alcohol consumptions or other diseases and risk factors linked to behavior. There is a lot that must be done to stimulate better cross-sectoral collaboration and addressing those wider determinants of health. Now, what happens though is that in times of crisis and when then money becomes tight, the first thing which is cut is actually prevention budgets. And I think once, I've heard many times, even from health ministers, saying that prevention must be the starting points of our health system. When it comes to really tough decisions about budget, very often that's what is cut. And you might be surprised to know that only 3% of total health spending is currently devoted to prevention and health promotion. So it's a very tiny function that requires much more investments. And we need to find ways to make sure that through rounds of different electoral processes, there is continued emphasis on ensuring such investments. The third area is really the importance of community care and primary care. So that first level of care, which is not the area that receives most of the resources and spending in health system. There is lots which goes to hospitals and only 14% of health spending that goes to the primary care or the first level of care. And I think we need to think about how we structure budgets in a way that ensure access to care for all. The fourth element I would like to say a few words is about the health workforce. And this is clearly a must. One thing which the crisis has shown to us is that the limiting factors for ensuring access to care were not having enough ventilators or having enough beds into a hospital, because you need a health worker to operate a ventilator, to administer a vaccine, even to do a test. And the global shortages of healthcare workers is really a very large number. Some 18 million health workers are estimated to be lacking by 2013, with the majority of those shortages being actually in low and middle income countries. So there is a really need to look at training capacities, but also how to address more the global dimensions of the migration of health professionals across countries. A large number of doctors and nurses that work in the most advanced economies actually come from lower income countries. And there is the need for a global response to global health workforce challenges that really make sure that we avoid also poaching on healthcare workers across countries, which would risk weakening even further health systems. There is an important role, and that's my important 6 points about digital technologies, and probably something that needs to be done. How can we make sure that digitalization and the transformation, the digital transformation of health system can come to the benefits of all? Now, COVID-19 has accelerated things like telemedicine in a way which really benefits very much everybody. And we have seen that some of the administrative barriers or even reimbursement barriers that existed before the pandemic can be lifted. So there are things that can be done, and perhaps a window of opportunity to jump on what is coming out of the pandemic to really make sure that we transform and modernize health system for the benefits of all. There is also another element related to digital, which has to do more with the use of data. I mean, data are really an opportunity, health data, for really much better monitoring of what happens in health system, surveillance of an emerging outbreak, or surveillance also of the quality of products, medical products, clinical optimizations and research. So huge opportunities, but there are also risks linked to the data governance and to the use in a privacy respectful way. And I think, we've worked in OECD very much with countries to promote a framework, an harmonized approach for good healthcare governance that really enable the use of data to save life and to improve quality of care, but in a way that safeguard privacy, that ensure the data can be shared and accessible within and across countries in a safe way. And I think following COVID, we will need to work much more to ensure the data are available quickly where they're needed to save life, but in a way that is safe, of course. My last point relates to the availability, obviously, of products like vaccine. And what we are seeing in the COVID-19 pandemic is really that there's been an immense efforts in terms of innovation to make COVID-19 vaccine available in really record time. This has been really a success story. However, what is less of a success story is where we are right now in terms of the distributions of vaccine and other products globally. And we know that only 1 in 10 people at present receives received at least 1 dose vaccine. Now, this is very much inequitable. So from a human rights perspective, it cannot see that we are in this situation right now, but it's also very short-sighted, even from an economic perspective, because the risk of creating or accelerating mutations of the virus of concerns, and therefore going back in a way in all the efforts and successes which have been done in vaccinating already large chunks of population in some countries, can actually be put to risk. And so it's really quite crucial that we advance discussion to make sure the vaccine are directed where the needs are the greatest, and also the commitment to things like licensing, sharing of intellectual property rights, facilitating technology transfer, and further developing manufacturing capacity are really encouraged and maintained. Now, let me finish just with 2 points. The first one is that quite clearly, as I mentioned, COVID-19 shows the need to invest more in health systems. But those investments are not just important from a human rights perspective, they're really important and also as investments in economies, in ensuring that we can go back to a normal life. And I think we need to build upon this dual narrative in order to make sure that we can sustain those investments in health system in the longer run. And secondly, it's quite clear that we cannot get there unless we have improved, enhanced, sustained international cooperation to help making further progress on prioritizing and sustaining such investments. And so many different areas that I mentioned, obviously, improve international cooperation to understand which policies work across countries, to eliminate any barriers in the expansion of global supply and distribution of vaccine and medical products, in sharing and benchmarking policies and their outcomes, in advancing even information efforts and tools to tackle health-related misinformation and disinformation, for example, in advancing and agreeing harmonized data governance systems and making sure that we can use those data in ways which benefit all, and also dialogue on the policy approaches to more ethically manage the international migration of health professionals. Those are all issues which will make a huge difference for the economic recovery, and obviously there are approaches that can and will save lives for all.
Thank you very much, Ms. Colombo, for these very strong messages and ending on a note underlining the need for international cooperation. I think today's webinar also exemplifies the willingness and openness for this. Thank you to all the speakers for their very useful comments and contribution. I think you have all touched on both policy and theoretical issues, as well as the very practical challenges related to applying health initiatives. And you've also highlighted the benefits that everybody can gain from really prioritizing these issues. We have time for discussion until our webinar closes, is due to end at 5 p.m. Central European Standard Time. I would like to reiterate that if you wish to take the floor, please write in the chat, write your name and your affiliation, and we will give you the floor. And you can intervene in English, French, or Russian. Please indicate the language. Maybe to kick off the discussion, I would like to give the floor to the rapporteur of the third committee, Vice President Carrie Henriksen of Norway, if she would like to kick it off. I know we had planned for you to wrap up, but I thought maybe since this is a topic that is very much that you hold at heart, if you would like to maybe kick off with a question. Vice President Henriksen, thank you.
Yes, thank you very much. And thank you very much for very good introductions from you all. And I think it's, when I listen to it and when I listen to the debate in the international organizations and also in the parliament at home, there are a lot of agreement about the needs. And there are a lot of commitment in words, what we have to do. But we see that there are less commitment which is reinforced into action. So I would just like to challenge you a bit. How can we work together to make parliamentarians globally and now in OSCE more committed to act? Because you have pointed out so many important issues, economy, prevention, and that health care and health issues are closely linked to human rights, other human rights, and that the inequality in social and economic factors impacts health, and that they are moving along with each other. So when one is negative, the other becomes negative, and that's a circle. So I just wonder if you could, from your perspective, what can we do as parliamentarians, and how can we challenge our parliamentarian associations to be more committed to action? Thank you.
Thank you very much for this open question. I was thinking, would one of our speakers also like to comment on this? We also have many parliamentarians who have connected today, both from our OSCPA delegations and also from IPU, representing a number of countries, I think, which have very different approaches. But perhaps would one of our speakers like to react? Yes, Ms. Cuevas, please, you have the floor.
Thank you very much. I think this is one of my favorite challenges. How can we translate international commitments into local, tangible realities? And yes, you're right. It is not only about a consensus on the needs. It's about reaching a consensus on the implementation process. And I think that we have everything in our hands as parliamentarians. First of all, we need to recognize that health is a human right, and that cannot be denied depending on gender or nationality or immigration papers. It's a human right. That's it. Once we recognize that, well, then we need to guarantee its implementation. We need hospitals, we need health workers, we need medical equipment, we need medicines. Allow me to go to a concrete example, my own country. I am from Mexico. A year ago, in February last year, just when we were touching for the first time the pandemic, I think it was a terrible timing, honestly, but we decided to change the constitution and to incorporate a kind of universality for healthcare and health access. Our problem is that we changed the constitution in terms of a concept of human rights, but we never allocated or changed, I think in a good way, appropriately, the legislation or our own budget. So we started the pandemic with a lot of problems in terms of salaries for the health workers, in terms of equipment, in terms of medicines, in terms of many, many things. And we are still struggling with that. I think that our mistake is that we had, as you said, we had the political will. We understood the need. We reached the political consensus. But we need to understand that it is not only about politicians. Political will is absolutely necessary because we have that power and that responsibility. But we need to work with people that are experts on this field. We need to get the health workers at the table, to hear them, to work with them. We need civil society. Sometimes they are the true heroes at the community level. We need to hear the technicians. There are a lot of technicalities involved in designing a good health system and strengthening it. So I think that, and that's probably what I like the most about UHC 2030, that we have different stakeholders sitting at the same table. We have the private sector, we have civil society, we are reaching parliamentarians, and that's why I am here. We are reaching local governments. We want to have a more comprehensive dialogue in order to build a clear, I think, a proposal for implementation. I think, yes, that's very challenging because we cannot make or design a tailor-made solution for each country. That's precisely the responsibility of each country's authorities. But I think that we can replicate the design and have strong partnerships dedicated to have a more comprehensive and, I believe, a well-designed and stronger health system.
Thank you very much, Ms. Cuevas. Would any of our other speakers like to react as well, or maybe have some concrete examples of how we have managed to move forward? Yes, Ms. Colombo, please.
Yes, and I'll obviously give a perspective from as I said, an organization that deals with the economics issue. But I think sometimes we take too much things as this is a human rights issue, this is an economic issue, and as I was saying, we should see the convergence in these agendas and probably start speaking a language that really can make a difference to the highest level of governments and the leaders. I think we need to push for having health very much of something on the agenda of leaders, and clearly the possibility that there might be a health crisis, it's something that requires the whole of governments, the whole of society, all different sectors, different actors actively converging. And so I think there is a need to try to elevate the agenda. Secondly, I think there is a need for how we speak about, health system, because very often health systems are seen like a cost, cost X of GDP or things like that, rather than what you get out of health system. And by that, I mean, not just obviously the human rights elements of getting access to care, and not just even the good outcomes in terms of living longer, living in good health, but even the, consequence in the effect that this creates for society as a whole. We're having students which are able to succeed in their studies and who are able to, for women in particular and girls who are able to progress in their lives, in their careers and support. for in the labor market for workers which are productive, which contributes, and also who are people and individuals who are able to get and maintain a job, because those who are in poor health very often are the ones who are more likely to be underemployed or unemployed, or when they're employed, to be even less productive. So there is really a rationale here which should speak at the highest level of governments. We're talking really about jobs. We're talking really about making sure that the future of our children will be upheld for the best. So I think we need to try to have perhaps a convergence in the way we speak about the benefits on investing in health from all those elements, and perspective, and try to make a very powerful arguments that can be moved forward and taken up. I think right now we really have the moments. I mean, the pandemic has so clearly demonstrated the need for investing in health, for putting health high on the agenda, for the fact that we cannot have any excuse for not having health systems which are resilient enough. I mean, the cost for economies and society is way too high, and it's unacceptable. So we must do, and we can do better in the future, and that cannot be done unless we have stronger, more accessible, higher quality health systems.
Thank you very much, Mr. Knight. Would you like to also make a few comments, please?
So thank you for the question. I think it's the question that's on a lot of people's minds, and I'll just make two kind of higher level observations. One suggestion would be to not let yourself in any leadership position get distracted. Focus on the fundamentals. We have not vaccinated enough people, and yet we have parts of the world that are already shifting resources and attention to vaccine passports. Instead of focusing on the fact that if we just had equitable vaccine distribution and access, we wouldn't need to distinguish between people on vaccination status. So it is tempting, especially in a crisis, to look for new solutions, but the fundamentals still work. And that leads into the second observation I would make is we have to be very careful that we don't shift blame for distrust of institutions onto individuals. We shouldn't think about people not trusting an institution, whether it be healthcare or some other form of service, as a problem of the person, but look at the institution and how to make it more trustworthy. Look at its history. What has it done? What has it delivered? And what has it failed on? And the truest form of accountability is to do better and to deliver better and to gain that trust such that the institutions genuinely work under their purposes. Thank you.
Thank you very much. And thank you for highlighting the issue of trust in institutions. This is an issue that comes up when it comes to the rollout of vaccination programs in migrant and refugee populations, where sometimes the reluctance for the uptake of vaccines is linked to the issue of trust, and perhaps not directly in lack of trust in the vaccines themselves. So I would like to pass the floor now back to Vice President Carrie Henriksen, if you wish to make some additional remarks. We don't have any requests for the floor. Maybe this indicates that there is agreement generally amongst our participants on these issues. Vice President Henriksen, please.
Yes, thank you very much. And I think that's one of the challenges, as I said, that it's so obvious that it's something we should do much about. But when it comes down to the practical political realities, it often is not the main issue or the fundamental facts, because it always is being challenged by so many other things. And I think it was very interesting to hear, because you have on different angles covered the need for protection, prevention, and financing the healthcare. And there are studies saying, as I think it was you, Mrs. Colombo, who talked about the gains, the economical gains, because when we are going to speak to leaders who have many other things on their mind. And in my experience, many leaders are too much occupied with roads and development of the more technical things in the society, and not with health. Health has, at least in my country, hasn't been so important a political issue, although we have a very good system in Norway, so I shall not complain about that. But I think to really make people understand that both when it comes to vaccine, if don't everybody get it, we are short. We are not in, we haven't done what we are supposed to do to protect everybody. And at the same time, I think to make people understand that there are good economy in doing prevention, and to make that knowledge into figures, that has been done, but to make it into real politics, that's another step, and it's more difficult, is my experience. But I think that is the way we have to go, and we have to make sure that also the international organizations collaborate to highlight the links between the human rights commitments that OSCE has in its values and in its goals, that healthcare is linked with all those values. And it is in a way to bring it up to discussion and to put it on the table that health is a separate issue that also is linked to other human rights issues. And if we don't solve health, then we will not get in any other goals, because they are so linked. And I think that's one of the reasons for me, for at least to raise health as a separate issue. And I think that's it's more neutral politically than equality, for instance. Equality is more politically divided, perhaps, than good health. I think good health has a more there are much more understanding about having a good health for everybody. But I think, I don't know if any other parliamentarians would share some experience from their own countries, because I think it was you, Kyle, who mentioned that the inequality is always affecting those who already are marginalized, also in health issues. So, and that could be, for instance, we had a discussion for some weeks ago, and then there were a parliamentarian talking about the pandemic, and she said, we don't have water in the rural areas of our country. How can we speak about washing our hands every now and then? Because we don't have access to water. So it's so linked to developing issues in the country and to distribute the wealth and the services. So I don't know if any other parliamentarians have some examples or some experience that they can share with us, what they have been doing to solve these kinds of challenges in their own country, and also maybe in international areas, how they have raised this kind of challenges.
Thank you, Vice President Henriksen, for these useful insights. Would anybody wish to take the floor? We still have an opportunity, and we do have, and if not, then I can also ask our three speakers if you wish to make any more concluding remarks. before we close the webinar? Would any of our speakers or any parliamentarians wish to take the floor? Any of our speakers? Or yes, Ms. Colombo, thank you.
Just briefly, because I do think that there is a window of opportunity, really. I mean, tragically created by the biggest crisis ever that we have witnessed in health, which has cascaded down to the entire society and economy. But there is a window of opportunity, and we must not let it go. And so, for parliamentarians, for everybody in their own respective role, I think it's now the moment to make the changes that will put ourselves in a much better position to not replicate similar situations into the future. And the changes are obviously quite wide-ranging that needs to happen, but there are some which are very simple, and we have known them for forever. I mentioned the importance of prevention, the importance of primary care. Clearly, there is an issue of how the discussion in Parliament can put health high on the agenda. I mean, on all the respective role that each of us have got, there is a huge window of opportunity, and I think we should not let it go.
Thank you very much. Before I give the last word to Ms. Cuevas, kind of as the person that initiated this webinar, Kyle, would you like to make a quick comment before I give the floor to Ms. Cuevas?
Sure, thanks so much. I think drawing on everything we've talked about today, just to look forward a little bit, right? I'll say out loud that I'm not 100% convinced that we need a pandemic treaty, right? But it looks like this is going to happen in November with a discussion. It came out of the World Health Assembly, and I'm sure everyone has seen the discussions about what this treaty might accomplish, what it might do. I actually think we had the tools in place to do better during the COVID-19 pandemic. And it's about asking those hard questions about the integration of economic interests and human rights interests and the confluence of those and where they overlap. It's asking the hard questions about investing in the mechanisms that do exist, investing in transparency, investing in accountability, investing in healthcare systems. I think we have those tools, whether we have a new treaty or not. And I would encourage you in the coming months, as the treaty dominates a lot of the global political discussion, to think hard about what this is going to accomplish. And if it goes forward, just remember those fundamentals. Remember the human rights protections. Remember the investments in universal healthcare. Remember the things that we know can be effective and just haven't been effectively invested in so far, and not let it become creating something new that doesn't necessarily create anything genuinely new. It just puts a new label on it. Let's think about the things we know that work. Let's think about the tools that we have to do better on crises like this and to treat people better and survive better, and reinvest in those along the way. Thank you so much for having us here today.
Thank you. And Ms. Cuevas, you have the floor. Thank you.
Thank you very much. I think that the only issue that I forgot to mention is the importance on having a gender perspective in all decisions that we take regarding health. This pandemic has exposed, I think, even more eloquently than the previous reality, the highly unequal access that we have to health. And it goes from very basic services and all the way to decision-making processes. Women are not well represented in any way. Even if we see, for example, the latest delegations to the World Health Assembly, only 23% of the members were women. And that's something that has a direct impact on the decisions, on the policies, on the agreements, on everything. So that's something that we need to change, and we need to understand that women and girls are suffering and are being discriminated at many kind of health policies. But at the same time, women represented 70% of the global health workforce during the pandemic. So that inequality is something that we really need to change, and we need to understand that's something that we have to speak openly and with a very important commitment and real solutions. So thank you very much for this dialogue, and if we can be helpful at UHC 2030, please let us know. We are working on a kind of handbook for parliamentarians, precisely on a direction to these how-tos. How can we make a difference? How to implement UHC at the national level? So if you want to participate, the invitation is always open, and thank you very much.
Thank you very much, Ms. Henriksen.
Yes, thank you. I just want to summarize a bit, and I was very pleased to hear the gender perspective, and that is also an experience I can share from my own country, that when we delivered good family health care and access to workplace for women, the last 20 years, the GDP has grown not because of our oil, but because of women's participation in the workforce. And the gain in the GDP is higher than the oil income. So it has impact on the income of the countries, how we deliver healthcare in the society. And I am very pleased to have listened to you, and you have brought a lot of knowledge and experience that we as parliamentarians can take with us in our discussions in the PA, and also challenge OSCE, the Ministerial Council, and the ministers in our respective parliaments. When we have these webinars, I hope some of us will take this knowledge back home and discuss it also in our parliaments at home, to raise issues that is important for parliamentarians, but not least important for the people that we are to put to, and we have got confidence to lead. I also want to raise the issue of the people on the move, because we were speaking about marginalized people who are the most vulnerable situations, and they are also those who are in most need of good health care. So I think that also is timely that we remind each other that there are people that are in more need than others to have access to good health care in every country, and that we also have to focus on that. And I would also like to thank all of you who have listened. Not so many have been speaking, but I hope you have been listening very well, and that the knowledge is useful for us in our future parliamentarian work in our parliaments back home, and not least in OSCE PA, where we will discuss this matter further. Thank you.
Thank you very much. Thank you also to all who contributed and participated. I hope this webinar has contributed to making sure this topic stays high on the agenda, both of our assembly and your respective parliaments and other fora. These are topics I know that are regularly debated by many of you in your national parliaments. So today's discussion hopefully brings some fresh perspectives to your national debates. I certainly think that our discussion today can inform future work in this field. I thank you very much, and we now declare this webinar ended. Thank you very much to everybody for participating.